In this episode, you'll discover the truth about the body's innate ability to heal itself and why, quote-unquote, incurable illnesses might not really exist. Welcome back to Renegade Remission. By the end of this episode, you'll understand how certain diseases have been shown to improve under specific biological conditions and why thousands of documented cases suggest that outcomes are not always as fixed as they seem. We'll walk through how to think about your own healing in a way that is both scientifically grounded and open to possibility. After a diagnosis, most people are given a framework for what to expect. Sometimes that framework is explicit, sometimes it's implied, but it usually centers around progression, management, and adaptation. You learn what the disease typically does, what treatments are available, and what the likely trajectory looks like over time. That information is helpful, but it is also incomplete. What often gets left out of that is that biology is not a fixed, linear system. The body is constantly responding to internal and external inputs, and those responses can influence how a disease behaves over time. This does not mean that every condition can be reversed, and it doesn't mean that outcomes can be controlled with certainty, but it does mean that the range of possible outcomes is far broader than many people are led to believe. To understand that more clearly, it helps to look at both controlled research and real-world cases where something unexpected occurred. In the Lifestyle Heart Trial, Dean Ornish and his colleagues studied patients with moderate to severe coronary artery disease, a condition long understood to be progressive and irreversible. Over time, plaque builds in the arteries, narrowing blood flow and increasing the risk of heart attack. Standard treatment often focuses on slowing progression or surgically bypassing blockages. What made this study different is that it tested whether comprehensive lifestyle changes could influence the disease process itself. Participants in the intervention group adopted a program that included a whole food, plant-based diet, moderate physical activity, stress management practices such as meditation and breathing, and structured social support. The control group continued with standard care. Researchers used quantitative coronary angiography to directly measure changes in arterial plaque. After 1 year, the intervention group showed measurable regression in arterial narrowing, while the control group continued to worsen. At the 5-year mark, the differences between the groups became profound, with continued improvement in the intervention group and further progression in the control group. This study demonstrated that the biological processes driving disease were modifiable, and under certain conditions, they could move in a different direction than expected. Now let's look at a survivor story of unexpected recovery beyond prognosis, as reported in the Renegade Remission database. Ann Fonfa was diagnosed with advanced breast cancer in her early 40s, at a point when the disease had already spread and her prognosis was considered poor. She initially pursued conventional treatment, including chemotherapy, but experienced such significant side effects that she needed to make the decision to stop treatment earlier than her physicians had recommended. Following that decision, she began exploring a wide range of approaches to support her health. According to both Turner's documentation and Fonfa's own public accounts, she made substantial changes to her diet, incorporated nutritional supplementation, and engaged in mind-body practices aimed at reducing stress and supporting emotional well-being. She also became deeply involved in building community and purpose, eventually founding the Annie Appleseed Project, an organization focusing on educating patients about integrative cancer care. Over time, her condition stabilized and then improved. She went on to live decades beyond her original prognosis, continuing her advocacy work and remaining active in the cancer support community. Her case is presented as one documented example of many where the trajectory of disease did not follow expected patterns. The Spontaneous Remission and Annotated Bibliography compiles more than 3,500 documented cases of unexpected recovery across a wide range of diseases. These cases were drawn from medical literature and case reports, not anecdotal internet stories, and they include conditions that are typically considered progressive or difficult to reverse. What this body of work shows is that unexpected reversal occurs often across enough conditions to warrant serious attention. It expands the understanding of what is biologically possible. But to have a meaningful conversation about disease reversal, it's important to move beyond the idea of binary outcome, that you're either sick or you're cured, and instead understand the underlying biological processes that can shift over time. Chronic inflammation is a shared feature across many diseases, including cancer, autoimmune conditions, metabolic disorders, and neurodegenerative diseases. Cytokines such as interleukin-6, TNF-alpha, and CRP influence not only immune activity, but also cellular signaling, tissue repair, and metabolic regulation. When inflammatory signaling decreases, downstream effects include improved cellular communication, reduced tissue damage, and better overall system regulation. It's also important to understand that the immune system is highly adaptable. In autoimmune disease, it may be overactive or misdirected. In cancer, it may be insufficiently responsive. Environmental and behavioral factors such as nutrition, stress, sleep, microbial exposure, and others can influence immune regulation. Changes in these inputs can shift immune behavior, altering how the body interacts with the disease process. Additionally, energy production at the cellular level is central to healing and repair. Mitochondria generate ATP for energy, which fuels immune function, tissue repair, and cellular maintenance. When mitochondrial function is impaired, the body's capacity to recover is limited. But supporting mitochondrial health through nutrition, movement, and reduced oxidative stress can improve cellular resilience and function and lead to healing beyond what is expected. And research in epigenetics shows that genes are not simply turned on or off permanently. Environmental inputs like diet, stress levels, toxin exposure, and sleep quality all can influence gene expression, particularly genes involved in inflammation, detoxification, and immune response. This means that even with a fixed genetic predisposition, the way those genes are expressed can change over time and can change the trajectory of a disease. In cancer, tumor growth is influenced not only by the cancer cells themselves, but also by the surrounding microenvironment, including immune cells, blood supply, inflammatory signals, and metabolic conditions. So changes in these factors can influence tumor behavior, including growth rate in response to treatment. And when you bring all of this together, a different picture emerges. Clearly, disease is not simply a static label. It's the result of many dynamic biological processes that are constantly responding to internal and external conditions. And many of the mechanisms that drive disease progression are modifiable. If we move away from the idea of reversing disease as a goal and instead focus on supporting the systems that influence how your body responds, the path becomes more realistic and more actionable. Let's discuss some practical action steps you can take today. Start by identifying the areas of your biology that are most likely to your current symptoms. For many people, this includes inflammation, metabolic stability, stress physiology, and sleep quality. Rather than attempting to overhaul everything at once, choose one area where you can begin making consistent, sustainable changes. For example, this might mean shifting towards a more anti-inflammatory pattern of eating, introducing a short daily stress regulation practice, or stabilizing meal timing to support metabolic balance. It is also important to pay attention to what may be interfering with your body's ability to function well. This often includes factors like chronic stress, poor sleep quality, inflammatory dietary patterns, and environmental exposures. Reducing these inputs can be just as important as adding supportive ones because it decreases the overall load your system is carrying. As you make changes, focus on direction rather than perfection. Small improvements in energy, sleep, pain, or mood are meaningful signals that your body is responding. Over time, these incremental shifts can accumulate into larger changes in how your body functions. Finally, it is helpful to hold both realism and openness at the same time. You can acknowledge the seriousness of your condition while also recognizing that your body is not fixed and that change, sometimes significant change, is possible. The question of whether the body can reverse disease does not have a simple yes or no answer. The body is not a static system. It is responsive, adaptive, and constantly interacting with the environment it's given. So while no one can promise a specific outcome, the evidence does suggest that the trajectory of illness is not as fixed as it may appear at the beginning. Your body is responding, adjusting, and the conditions you create around it have the power to influence what happens next. In our upcoming episodes, we'll continue discussing ways that you can influence your healing trajectory. So stay tuned for those episodes, and as always, go be renegades.